Hello, Nurse Pronto crew. It is Dr. O, and it is time for another quick NCLEX Pop Quiz. So let's test your critical knowledge and thinking. We're going to do 3 high-yield questions that you may see on exam or in clinical practice. And if you get the answer, I'll break down the answer rationale. Okay, so let's go ahead and go. Question 1, which assessment finding requires immediate follow-up during a head-to-toe assessment? Look at those, tell me which one you think, and if you guess C, crackles heard in the lower lung fields, you are 100% correct, okay? Crackles, especially if they're in the lower lung fields, can indicate fluid overload and the early signs of heart failure or pneumonia, and so that is an immediate follow-up because that can impair oxygen exchange and that can worsen really quickly if it's not treated. So cap refill of 2 seconds, if you're thinking that one, or equal reactive pupils and warm dry skin, those are all normal findings. So they're good to go at that point. So always prioritize findings that signal any kind of respiratory or circulatory compromise. That is your NCLEX tip. All right, let's go ahead. You're doing great. We're going to move on to the next one. When assessing peripheral pulses, what is the nurse's primary evaluation, or what is the nurse primary evaluating? So think about that. You're looking at peripheral pulses. Is it O2 sat? Is it cardiac output? Is it blood pressure? Is it respiratory function? And if you answered B, cardiac output and perfusion, you're 100% correct. So give yourself a nice round of applause. Peripheral pulses really reflect how well the heart is pumping and that blood to the extremities, which is a direct indicator of cardiac output and tissue perfusion. So, and you've got to remember, oxygen sat and blood pressure, they require specific tools, right? While respiratory function is assessed through lung sounds and rate, not pulse quality. So a little clinical pearl here. If it's a weak or thready pulse, you got to think shock or poor perfusion. All right, let's move on. Last and final one. Let's see how you do. Hopefully you get them all 3 right. A patient has a Glasgow Coma scale of 9. What does that indicate? Are they fully alert and orient? Are they in a comatose state? Do they have moderate neurological impairment or no neurological deficits? If you answered C, moderate neurological impairment, you are right. That score of 9 means the patient they're not comatose, okay, because that's less than 8, but they're not fully alert either. So that score indicates moderate impairment. They may respond to little stimuli, but not appropriately and definitely not consistently. So here's your little quick breakdown. If it's a 13 to 15, that's mild, no impairment. So if it's 9 to 12, that's moderate impairment, and less than 8, that is coma. All right. So very, very good. Let me know how you did in the comments, and don't forget to follow us at Nurse Pronto for more nursing exam tips, for daily quizzes and contents to help you pass confidently. All right, you have absolutely got this.